Hi, this is Dr. Bonn, and I want to talk now about what talk therapy is all about. You know, we live in an age where therapy just abounds. There's physical therapy, there's chemotherapy, there's radiation therapy, all kinds of medical procedures. But talk therapy itself is very different from these standardized medical therapies because there really can be no two talk therapies that are alike. It can't be standardized because no two people are alike, no two therapists are alike. Also, talk therapy differs from these other therapies, medical therapies, because it's not a passive procedure that is imposed upon you by a professional, but rather it's a cooperative effort. Therapy cannot be of help unless both patient and therapist agree on what the goals are. No therapist can ever know more about a patient than the patient himself or what a patient is feeling. So cooperation is key to good therapy. Now, there are different terms in psychotherapy that refer to different emphases in helping people. Psychoanalytic psychotherapy that you hear about has to do with helping to discern, uncover, and understand how past events and past experiences shape our current lives and upset us in the present. Cognitive behavioral psychotherapy is another kind of therapy that has to do with the giving of practical tools to help people to get around dysfunctional ways of thinking and behaving that get them into trouble. Dialectical transactional psychotherapy has to do with looking at the relationship between the patient and the therapist to help to understand patterns of difficulties in relating to other people. Now, medical psychotherapists do all of these things. An experienced psychotherapist knows which technique to use when. And a medical psychotherapist, in addition, is able to deal with upsetting, urgent problems in the moment, such as insomnia and toxic emotion. He stands ready when these are overwhelming and make any kind of therapy really impossible and functioning impossible. Medication can address agitation, which is threat and anger and panic all at once. It can address catastrophic thinking. The medical therapist stands ready to take care of medical crises. Now, it's really crisis that gets people into therapy to begin with, but once the crisis is over, therapy can shift its focus to more long-term problems that are troublesome in a person's life, such as perfectionistic judgmentalism, such as difficulties in dealing with people, coping with people, such as the emotional hypersensitivity that people have, and over-worrying about upcoming events. Long-term therapy also requires a reevaluation and updating of what the goals of the therapy are between the patient and the therapist, so that a lot of the work of therapy can then be delegated outside of the office where the patient can do the therapy on their own under guidance with considerable saving. Now, because therapy has never been a standardized procedure, and because in fact some of us were really too unfocused in our therapy years ago, there was a sudden change overnight about 20 years ago, and insurance companies stopped paying for most therapy by experienced therapists or at rates that would be appropriate to experienced therapists. As a result, some of our colleagues have stopped doing therapy, but many of us have continued to work and to develop and to focus and hone in all of our skills and all of our techniques to make efficient and effective psychotherapy out of the insurance network possible in this day and age. You can attain good psychotherapy and good medical psychotherapy. Don't give up the search. This is Dr. Jerrold Bonn, and thank you for listening.